Cerebral palsy or CP is considered a neurological disorder caused by a non-progressive brain injury or malformation that occurs while the child's brain is under development. It also affects body movement and muscle coordination. CP is actually caused by a brain damage caused by a brain injury or abnormal development of the brain that occurs while a child's brain is still development before birth, during birth, or immediately after birth. CP affects body movement, muscle control, muscle coordination, muscle tone, reflex, posture, and balance. It is the most common motor disability of children. It's more common among boys than girls. CP is considered to be a non-life-threatening condition. Most children with CP are expected to live well into adulthood. Every case of CP is unique to the individual. One person may have total paralysis and require constant care, while another with partial paralysis might have slight movement tremors but require little assistance. That is due in part by the type of injury and the timing of the injury to the developing brain.
Cerebral palsy is classified depending on which part of the brain is damaged that affects the motor skills. There are 5 different types. The first one, spastic cerebral palsy. The most common type that is over or above 70% of all cases. This type is caused by the damage to the brain's motor cortex, the part of the brain which controls voluntary movements. This causes the muscles to appear stiff, causing their movement to become awkward. Second, dyskinetic cerebral palsy, caused by the damage to the brain's basal ganglia and or cerebellum. This is characterized by the combination of loosened muscles, hypotonia, and stiffened muscles, hypertonia. The most common symptoms are uncontrollable or involuntary movements. Third, ataxic cerebral palsy. This is caused by the damage to the brain's cerebellum, the part which is responsible for body's coordination and movement. The most common symptoms are poor coordination, shaky movements, and unstable balance. Fourth, hypotonic cerebral palsy, classified by low muscle tone that causes loss of strength resulting in floppy movements. This type can cause a child to miss development milestones like crawling, standing, or walking. The last type is mixed cerebral palsy, characterized when a child has 2 or more types of cerebral palsy. The most common combination is spastic dyskinetic cerebral palsy.
Cerebral palsy is caused by abnormal development of the brain or damage to the developing brain. It affects the part of the brain that controls body movement, coordination, and posture. The abnormal development of the brain or damage that leads to CP can happen before birth, during birth, within a month after birth, or during the first years of a child's life while the brain is still developing. There are some signs that may indicate a child has cerebral palsy. Not all signs are visible at birth and may become more obvious as babies develop. For example, low muscle tone, poor muscle control, reflex and posture, delayed development, can sit up or independently roll over by 6 months, feeding or swallowing difficulties, prefer to use one side of their body. Then, some of the risk factors for congenital CP are low birth weight or preterm birth, fever during pregnancy, infertility treatments, infections during pregnancy, if a mother is exposed to a toxic substance, and complicated labor and delivery.
Cerebral palsy diagnosis. There is no single or simple test for cerebral palsy. Most children with cerebral palsy are diagnosed during their first 2 years of life. But if symptoms are mild, a healthcare provider may not be able to make a diagnosis before the age of 4 or 5. It's important to see a specialist if you think your child is showing developmental signs of cerebral palsy. Cerebral palsy treatment is not focused on curing or fully correcting a child's condition. Treatment focuses on nurturing a child's remaining skills to reduce symptoms and encourage an independent life. Medications may be used to treat some symptoms of cerebral palsy, including involuntary movement, seizures, and spasticity. Medication may also be used to treat secondary disorders caused by cerebral palsy, such as incontinence, acid reflux, behavioral disorder, and more. There are many different therapy options to help treat cerebral palsy symptoms. Therapy can be used to improve mobility and brain's cognition. Surgery may be recommended for children with severe mobility and muscle issues. Surgery for cerebral palsy can correct or improve issues with movement.